Hi, this is Dr. Bob Dannenhoffer. I'm the public health officer from Douglas County, and we frequently get questions by email. And so people can send those questions to us at Facebook questions at douglaspublichealthnetwork.org. We've gotten a few this week, and there were three in particular that I wanted to deal with. The first one was about new and dangerous variants. So right now in Oregon and in much of the country, almost all of the cases are caused by the Delta variant and some offshoots of the Delta variant. So the Delta variant first developed in India and really spread quickly through India, seems to be much more contagious than the previous forms. It probably doesn't cause more severe disease, but because it's more contagious, you see a lot of cases. Now, there's some controversy about that. There's one study in England suggests that Delta is perhaps results in more in infections that result in hospitalizations, but we're not sure about that. It's also a little different in how it comes on. The Delta variant very frequently starts off with upper respiratory symptoms, runny nose, sneezing, sore throat, and headache, and don't have the fever and cough until later. So people on the first day of what seems like a cold go to work and spread it to others. So with the Delta variant, we're asking if you're sick with anything, cold symptoms, cough, headache, runny nose or sore throat, that you stay home until we know whether or not it is COVID. Now, there are two new variants that are out there that we're worried about. One is the Lambda variant, first seen in Peru, and then the MU variant. The MU variant is a concern. It's been seen in small amounts across the country and in many places around the world. This MU variant contains some of the mutations that you saw in the Alpha variant, first seen in the UK, and the Beta and Gamma variants seen in Brazil and South Africa. Those are worrisome because it appears that some of those may make it harder for the immune system to attack the virus, and that could be a problem for people either have immunity because of previous infection or because they've got immunity from the vaccine. So those are the ones we're going to look at very carefully. But right now, the big dog on the block is the Delta. Of our last cases in the last 2 months, almost all have been Delta. We had one Alpha, but almost everyone else has been Delta. The second thing that was a lot of questions about this week is about a booster or a third dose. So the CDC is preferring to call it a third dose because it really is a third dose of the previous vaccine. It's not different. It's not a booster in the typical way we think of a booster being an updated vaccine. It's the old vaccine, but a third dose of that. And that's not surprising. When we look at other vaccines that we give, we frequently give 3, 4, or 5 doses to get full immunity. So not shocking that 3 doses of these mRNA vaccines will give better immunity than just 2. Now, right now, the only groups for whom this third dose is recommended are people with weak immune systems, say people who've had an organ transplant, or people with end-stage HIV, or people with active cancer, or taking drugs that might affect your immune system. We've already given quite a few third doses, and so that group is eligible for a third dose. But whether those of us who are older, people who work in healthcare, or people with other conditions need a third dose is still up in the air. We've been told that we're going to find out sometime in September about a third dose, but we don't know about that. The other question comes up is about when are vaccines for kids less than 12 going to be approved? And again, I don't know the answer to that either. It looks like probably not for a couple of months for kids between 6 and 12, and a few more months after that for kids less than 6. The other vaccine news we're waiting for is what do we do with subsequent doses of the J&J vaccine. So the J&J vaccine made by Janssen is just a single dose. And right now there are no recommendations for follow-up second doses or booster doses with that, but we're carefully looking for it. Wouldn't be shocking that you might need a second dose because the J&J is similar to the AstraZeneca vaccine that's been used in Europe, and that one is a 2-dose vaccine. And then the last question about the new vaccines is about the Novavax. So Novavax is a protein vaccine. Some of the people who are looking a little leery about the mRNA or the adenoviral vaccines, which are relatively new forms of vaccine, are looking for the Novavax vaccine, which is a protein vaccine similar to the old vaccines that we had, say, for hepatitis B. Those are still looking for approval, and we have no new data on when the Novavax is going to come through. And then the last question, this is a question we've gotten from the very beginning of the pandemic, is how do we count deaths and how do we count COVID deaths? So I will tell you, I do get a chance to review the medical records for all of the people who die. And we get a chance to look at the records either as discharge summaries from other hospitals, talking with the physicians, or actually looking at the records ourselves on the computer. And I will tell you, the overwhelming number of deaths are people who were, however they were, sick or well, they got COVID, they got sick with COVID, they had lung changes in their oxygen, troubles breathing, and in the end died because they had COVID. So overwhelmingly, that's the case. Now, we have had some hospitalizations of people who have COVID but are not in the hospital because they have COVID. For example, a woman who is pregnant and has COVID but doesn't really have any symptoms comes in to deliver her baby. She's in the hospital and has COVID, but she's not in the hospital because she has COVID. She's in the hospital because she's delivering a baby. And during this pandemic, we see that a few percent of our hospitalizations are people in the hospital and have COVID, but they're not in the hospital because they have COVID. But well over 90% of the people who are in the hospital because they have COVID. Similarly, we look at deaths, and it is certainly possible that somebody could die, say, of a car wreck, come into the hospital very, very ill. They do blood work or testing and show that this person has COVID, but really they didn't die of COVID. They died of the car wreck. Of all the deaths, and we've reviewed them all, there's a single death that I think that you would say would have happened, and the COVID was simply incidental. And so that's the case. Now, there are some cases where people are really old and sick, or young and sick, or whatever. They've got an underlying condition which really weakens them. Say they have cancer, or say they've got Alzheimer's and dementia, or say they've got end-stage emphysema. And then what happens is they get COVID, and the COVID is the last straw, and they die. Now, in the end, there's no way to know when somebody would have died from their emphysema or from their cancer or from their Alzheimer's. But if they had symptoms of COVID, low oxygen levels, pneumonia, other kinds of problems, and that hastened to death, then that is considered to be a COVID death. And that's the way we do it with everything. So when you die of cancer, you almost never die of the cancer itself. You die of a side effect from the cancer. So you have cancer, and then you get a bowel obstruction, you die of a bowel obstruction. It was the cancer that caused the bowel obstruction, but appropriately, the death would be recorded as a bowel obstruction secondary to breast cancer. Similarly, if you were an old person in a nursing home and got the flu and then died, the cause of death would be flu, complicated by your underlying frail state or dementia. What we do for COVID is absolutely no different than we do for any other disease. We do not record COVID deaths any differently than we record deaths from Neisseria meningitidis, Bordetella pertussis, or anything else. Is we follow those things. And when we have questions, we don't just wing it. We call an expert. So I call the state medical examiner, and we review the case, and we try and get what the cause of death is. And again, this idea that people are making up deaths is really not true. I get to look at all of them. The sense that many of these people are dying and might have COVID, but they didn't die because of the COVID is true in only a tiny number of the cases. In all the cases that we have reported here, COVID was a significant contributing factor to the death. That's complicated, and I will tell you, even among physicians who do death certificates, that's always a confusing part. So when we have questions, we call in the experts. But I can tell you and promise you that when people are dying and they're reported as COVID deaths, that COVID was one of the factors that led to their death. Well, that's the questions we have for this week. Again, if you have questions for us, please send them to us at Facebook questions at douglaspublichealthnetwork.org, and we'll try and get to those questions. Again, Dr. Bob Dannenhoffer, Public Health Officer for Douglas County. Thanks for joining us.